rolling, Kyle?
Yep.
Okay.
Can we move over just a tad,
Okay, so we had a pop-up safe injection tent pop up in Moss Park over the weekend. Didn't have the blessing of the city or police. What's Toronto Public Health stance on this tent?
Well, I think what you're seeing and what we saw over the weekend was a reflection of our community partners' concern over the situation that we're seeing in our city with respect to drug use and overdose that's related to that.
And what is public health stance on it? Are you in favor of this kind of pop-up site showing up?
Well, I can tell you that we share the concerns of our community partners around the negative impact that drug use and overdose related to drug use is having on our community. And so with that in mind, what we're actually doing as Toronto Public Health, with the full support of our city government and our partners at Toronto Police Service, is working very hard to implement what I would call interim supervised injection sites so that we can address the current situation such as it stands.
So this is going to be something like a pop-up, but it's going to be more permanent. So where would those be, and when are they going to be opening?
So in fact, what we're looking at is interim supervised injection sites located at the sites in the city for which exemptions have already been provided. So already previously approved locations for interim supervised injection sites. At the same time, what we're trying to do is make sure that we're expediting the work such that the more permanent supervised injection sites and the work that's being done to actually get those up and running is proceeding as quickly as possible.
So when will these interim sites be opening?
Hang on a second.
So yeah,
you're going to have to ask one question.
Same question.
When are the interim sites opening?
So we're trying to open them as quickly as possible. I'm expecting that it'll be on the order of several days. I can't give you an exact date.
And how many of them are you going to be opening up?
Again, still very much in the works. I'm looking at making sure that we're looking at those interim sites occurring in the locations that have already been previously approved. And as you know, there are 3 sites in the city that have been previously approved for supervised injection services.
So you're going to have one here at Public Health?
That's our plan.
And then where are the other 2 going to be?
So the other 2 previously approved locations for supervised injection services are South Riverdale Community Health Center and Parkdale Queen West Community Health Center.
So they'll be open this week?
We're aiming for sometime in the next several days, but again, there are lots of logistics, lots of things that need to be taken care of, because we want to make sure that we're providing these interim supervised injection services in a manner that's safe for the clients and of course for our staff. And at the same time, what we want to make sure is that when we're doing this work, and when we provide interim supervised injection services, that it doesn't impede our ability to make sure that the permanent supervised injection services and those locations are the construction and all the prep that has to happen for those, that's still proceeding as quickly as possible.
The one thing that these organizers kind of proved with this pop-up injection site is that all that's needed is something like a tent, a table, and some medical staff to oversee it. Why were they able to do it in almost a weekend, yet we were, up until what you just announced, we're having to wait till fall for these permanent safe injection sites?
Well, supervised injection services are health services, and if you want to provide them in an optimal fashion, in the best fashion that's safe for clients and for the staff that work within those settings, there are a number of arrangements and considerations that have to be looked at and made sure that we need to make sure that these circumstances are well looked after.
Can you describe the crisis that we're facing? Tell us how dangerous and how much of an issue this is.
Well, drug use and overdose related to drug use is not a new issue for our community. And like many other large cities, this is a situation that we've been dealing with for years and arguably even decades. And that's why we've actually taken the time to put together a Toronto Overdose Action Plan. Has 10 clear strategies with several actions underneath each of those strategies to provide a comprehensive approach.
But it seems we're seeing a much larger number of deaths recently with regard to opioids. Can you just get into the number of deaths and the people who are overdosing and people? What are the numbers like right now that you're seeing at the hospitals?
So I don't have the specific numbers with respect to deaths at this point in time for today. But what I can tell you is that yes, we have been seeing an increase, and that's why we're talking about accelerating and expediting the plans that we already had in place. The other thing that I would tell you is that what comes to hospital, I suspect, is only part of the story. There are people, and we hear this, and this is part of that very important collaboration that happens with our community partners, is that they're able to tell us what's happening out on the street. So we know that there are circumstances and overdoses that are happening within our community that don't necessarily come to hospital or come to medical attention. 911 may not be called, and thankfully some of those situations are being averted by the fact that there is somebody around who actually has naloxone and is actually able to reverse that overdose. So I can't emphasize that enough, that for those who are using drugs, do not use alone, right? Have a buddy, have somebody with you, have naloxone, and if there is a circumstance where an overdose is suspected, use the naloxone and call 911. It's a very important step that can be done in terms of preventing the worst outcomes associated with overdose.
You described in terms of the wait to set up these permanent safe injection centers because you want the optimal conditions. Are you kind of referring to that what's happening in Moss Park right now is not the optimal settings?
Well, I don't think it's really for me to comment on other organizations' health services. What I'd like to do is make sure that at Toronto Public Health, when we offer a health service, that it is safe and high quality for the clients and for the staff that run that.
They argue that's happening there.
Can you just tell us what kind of staff you're going to have on hand?
I'm sorry?
At the interim sites, what kind of staff are you going to have on hand?
Well, there'll be Toronto Public Health staff for sure at our site, and we're talking about trained individuals who are able to adequately supervise drug use.
So 1-2 staff members?
Again, some of the details are still being worked out, not prepared to comment.
So what's the difference between the interim and the permanent?
When you have your interim site set up, would you rather people come here to use those sites than use the site at Moss Park?
So what I would actually suggest is that when we have an interim supervised injection service, whether it's interim or permanent in nature, it will provide a location where drug use can occur in a supervised fashion, thereby minimizing any risk, or as much risk as we can with respect to the product and with respect to drug use. So that would be my comment.
So, sorry, just to clarify, what's the difference between an interim site and a permanent
the
site?
need for that pop-up site, another pop-up site. Is that
So
right?
I'm sorry?
Will the interim sites obviate the need for other pop-up sites?
Well, I think there are a couple of things. One, the interim sites are meant to address some of the need that exists out there. But as we have at Toronto Public Health have been trying to publicize, and let our public know, if you are going to use drugs, we would recommend that you not use alone, that you make sure that naloxone is available, that you're with somebody who has naloxone, knows how to use it, and in the circumstances of an overdose, to call 911.
Sorry, what is the difference between the interim and the public
came
site?
About, is it a result or a direct result of what happened over the weekend with the safe injection site at Moss Park?
So the interim supervised injection sites and the decision to proceed with interim supervised injection sites results from a couple of things. One, it's a concern that we have and that we share with our community partners around the impact that drug use and overdose related to drug use is having on our community. And two, it's in response to the circumstances that we're seeing with respect to the overdoses that we're hearing about, both through formal channels, through what we're hearing about what's happening, hospital presentations, emergency department presentations, but also the information that we're receiving from community partners around that which is happening out in our community.
Sorry, what's the difference between the...
We're going to make this one the last question.
And which approved site are you going to be expecting to have that interim location opened up at first?
All three.
Well, I can speak at this stage of the game for us in Toronto Public Health. We're talking with our partners at South Riverdale Community Health Centre and at Parkdale Queen West, and we'll hopefully have some news for you in the next week.
So you didn't explain what's the difference then between these interim sites and the permanent ones that will go up in the exact same locations?
So I think when we're talking about an interim site, it's put together in a more rapid time, and it will not be as one sizable or as substantive as that which we will have in our permanent sites.
Thank you.
Okay, so we're going to call it a day. Thank you very much.